All right, everybody's favorite subject, spending your hard-earned money on healthcare costs. What a crummy way to spend your retirement savings. I don't think when you were saving all those years, you were saying to yourself, I can't wait to get to be retired and to spend my lifetime of savings on healthcare costs. But this is one of those realities. So healthcare costs are a non-negotiable line item in every retiree's budget. And I know the word budget is not fun, but remember, in the retirement budget calculator, one of the unique features is that we allow you to assign an expense as either essential or discretionary. And something like healthcare costs are going to be essential. This is something that you can't do without. You can always cancel a vacation or sell an RV, but your medication and trips to the doctors are necessities. While you can't reduce healthcare costs to zero, you can optimize your spending by understanding Medicare and the cost structure. And so I'm going to share 6 tips to help you optimize healthcare spending in retirement. At the very end of today's show, I've got a couple of unique situations that have come up over the years that I want to share with you. And so be sure to stay tuned to the very end. Medicare is a complex system with many moving parts. Figuring out the right plan is tricky. Evidence shows that just 1 in 20 people choose the drug plan that minimizes their out-of-pocket expenses. Figuring out how the system works can be a full-time job. Thankfully, many people volunteer their time to help retirees figure out this system. You can find local resources by entering your zip code at eldercare.gov. And in this episode, I'm going to include show links for a lot of these different resources. So if you visit Sound Retirement Planning, click on episode 349, you will see all of the links to all of these different resources on this topic of Medicare. As you prepare to meet with someone locally, it can help to know a couple of basics about Medicare. First of all, Medicare Part A covers hospitalizations, skilled nursing facilities, hospice, lab tests, surgeries, home health care. Anyone who paid into Medicare for at least 30 quarters will receive Medicare Part A without paying a premium. Now, when I mention skilled nursing facility there, you have to be really careful because that benefit is very limited when it comes to long-term care and skilled nursing facilities. So make sure you understand the rules. But generally speaking, there's about 100 days worth of coverage, but that 100 days is really tricky. You have to qualify. You have to be showing signs of improvement. There's co-pays that are included. So don't think that Medicare is going to cover long-term care because it doesn't. But there is a limited benefit there. Okay, Medicare Part B is most similar to health insurance from an employer-sponsored health insurance plan. It covers doctor's visits, outpatient care, home health care, durable medical equipment, and some preventative services. Currently, the standard rate for Medicare Part B is $148.50 per month. The Medicare Part B deductible is currently $203. And after you meet the deductible, you typically pay 20% of the Medicare approved amount for most doctor services. So you think of this as insurance as kind of an 80-20 split. You've got the 80% that Medicare covers for approved services, and then you have the 20% that you're going to be responsible for. The key language there is Medicare approved. And so you want to make sure that the treatment that you're receiving is approved by Medicare. The next part of Medicare is what we call Medicare Part D, and this covers prescription drug costs. The average cost currently is about $42 per month, but premiums will vary based on coverage. Then the next piece to Medicare is what we call Medigap. And Medigap isn't a part of Medicare. Instead, these are the supplemental plans that cover services that aren't covered by Medicare's Part A, B, and D. These are standardized plans, typically with the letters A through N in most states, that offer a variety of coverage options. You can learn more about the offerings on the website medicare.gov. Medicare plans can help you save money overall, but you need to be careful to find the right plan that fits your needs and the best deal on the right plan. Research from a website called Value Penguin shows that premiums for Plan A range from anywhere from $147 to $784 per month. One of the things that the state of Washington used to do was they would publish the standardized Medicare plans and how much the different insurers charged for those different plans. And it was really interesting. I haven't looked at that chart in a while, but it used to be if you had a plan F or a plan G, that you could look at one company would be offering it at one price and another company would be offering it at a significantly higher price, and recognize that the only difference between the coverage was the company that was offering it, because those standardized plans all have to be identical. So it's important that you shop them around and you look at the different companies and you look at the premiums being offered in your state. The last thing to know is Medicare Part C. So Medicare Part C are most commonly known as Medicare Advantage plans, and they are plans that bundle Medicare Part A, Part B, and Part D into a single plan. And enrollees can opt for a Medicare Advantage plan rather than paying for each part individually. Here's a list of things that are not covered by Medicare Part A and Part B. So long-term care, most dental care, eye exams related to prescription glasses, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting them, and routine foot care. It's interesting, I know some people continue to work until age 65 just so that they have Medicare coverage. I've talked to many people over the years that will postpone getting important medical procedures done until they're eligible for Medicare. Things like hip replacements and knee replacements. Oftentimes I'll see people postpone those. They'll be walking around with a cane until age 65 because they don't want, or they don't have quality health insurance before that time. We have a new administration, we have a new Congress, and I saw recently that there was some legislation introduced to try to drop the Medicare eligibility age from age 65 all the way down to age 50. I know the president at one point talked about dropping the eligibility age for Medicare from age 65 down to age 60. However, in a recent speech, he did not mention anything about this idea. And even though he campaigned on it early on, we have not heard anything about Medicare eligibility age changing. So for now, we need to be planning on Medicare starting at age 65. People who are 65 years old must enroll in Medicare Part A and B unless they have a qualified exception. Anyone who fails to enroll faces steep penalties for the remainder of their time in Medicare. Those who do not sign up for Medicare on time will pay a 10% penalty for each 12-month period that they were not enrolled in Medicare Part B. They will pay a 12% penalty for each 12-month period that they were not enrolled in Medicare Part D. Those penalties can really stack up over time. A person who enrolls 3 years late for Medicare Part B will pay 30% penalty for life. So in 2021, a 3-year late enrollee will pay $193.05 per month instead of the standard $148.50 per month in the current costs. The average prescription drug plan, Part D, currently costs about $42 per month. A person who enrolls 3 years late will then be paying $57.12 per month. Medicare gives detailed information about what each person must enroll in Medicare. So be sure to check out the site. Age 63 to 64 is really when you want to start thinking about Medicare and what your health insurance options are going to be. Or if you're planning to retire a lot earlier, you might want to start thinking about how you're going to cover health insurance costs before you get to age 65. If you already receive Social Security benefits, enrollment is automatic. The Social Security Administration handles enrollment for people who have already started taking Social Security. Everyone else needs to think about enrollment, even those who are still working. If you aren't covered by an employer plan, enroll at age 65. Even if you aren't taking Social Security checks, you need to enroll in Medicare Part A and B at age 65. And you can start enrolling 3 months before you turn 65. If you're working, don't assume you have an exemption. People who are covered by an employer-sponsored health insurance plan may be allowed to defer Medicare enrollment, but that isn't always the case. People who work for a company with fewer than 20 employees who are part of a health plan must enroll in Medicare at age 65. Those who work for larger companies should check with HR to ensure that their health plan qualifies them for an exemption.